Preventing and living with arthritis. What is arthritis? Arthritis is very common but is not well understood. Actually, arthritis is not a single disease. It is an informal way of referring to joint pain or joint disease. There are more than 100 different types of arthritis and related conditions. People of all ages, sexes, and races can and do have arthritis, and it is the leading cause of disability in America. More than 50 million adults and 300,000 children have some type of arthritis. It is most common among women and occurs more frequently as people get older. Some different types include degenerative arthritis or osteoarthritis, inflammatory arthritis, which is rheumatoid or psoriatic, infectious. A bacterium, virus, or fungus can enter the joint and trigger inflammation. Or metabolic. When a body cannot get rid of all its uric acid, it may trigger sudden and extreme joint pain. Some possible symptoms may be swelling, pain, stiffness, and decreased range of motion. What are some ways to prevent and manage arthritis? Keep moving, get enough sleep, eat well and keep a healthy weight, don't overdo it when you exercise, better posture and body mechanics, get enough calcium, have a strong core, and don't smoke. Keep moving. This can be anything you enjoy. Some great ways to stay moving for arthritis in particular are swimming or water exercise classes, also known as hydrotherapy, Tai Chi, walking or Nordic walking, chair exercises, low impact aerobics, strength training, and dancing. If you don't enjoy any of these, that is perfectly okay. Just find something that will keep your joints moving in a safe manner and that will improve your strength and cardiovascular fitness. Exercise can facilitate joint nourishment, ease pain and joint stiffness, and improve flexibility and mobility, build muscular strength and improve balance, reduce joint deformity and improve posture, prevent or manage osteoporosis by maintaining bone density, improve overall health and fitness, and lower stress levels, and help maintain a healthy body weight. Getting enough sleep and eating well. Poor sleep habits can worsen arthritis, pain, and fatigue, but there are things you can do to help you fall asleep and stay asleep. Make your bedroom dark, cool, and quiet, avoid caffeine or strenuous exercise in the evening, and wind down with a warm bath or practice relaxation techniques before bedtime. A healthy diet, when combined with exercise, can help you achieve and maintain a healthy weight. Also, adding foods with anti-inflammatory properties and that are rich in antioxidants can help control inflammation, such as fish, walnuts, leafy greens, and for a treat, try an ounce of dark chocolate. Eat real food and cut out the processed garbage. Weight loss is bound to occur when you are getting enough sleep, eating well, and exercising. This is crucial for those suffering from arthritis because for every pound lost, there is a 4-pound reduction in the load exerted on the knee. Imagine how much better you will be able to move. If you invest in yourself and recognize your responsibility and ability to take good care of yourself, you can live well with arthritis. You'll need to make adjustments, but make sure your goals are realistic, even if they involve only small steps right now. No one can take better care of you than you can. Don't overdo it. Make sure to get enough rest. See your doctor before starting any new exercise program. If you have had a joint replaced, find out from your surgeon or health professional which movements you should limit or avoid. While it is important to exercise and move more, it is also important to know your limits. Don't exercise a painful, inflamed, or hot joint. You can move the joint gently through its range of movement to help reduce stiffness and improve circulation. Don't try to do too much too soon. If you feel out of breath, slow down. If your joint feels particularly painful afterward, for longer than 2 hours after an exercise session, reduce the intensity of your next exercise session. If an activity causes you pain or increases your pain beyond what is normal, then stop this activity. If you are someone who has always been active, taking more rest can be difficult. Just know that you need to listen to your body, and sometimes that means to take it a little easier. A strong core leads to better posture and body mechanics. A weak core can lead to a whole string of issues such as back, neck, shoulder, hip, or even foot pain. When the core is not engaged or working properly, it can cause misalignment issues within your entire body. Any joint inflammation, soreness, or burning could be reduced if your body is aligned properly and working together as it should. Your posture plays a key role as well. Bad posture means your core is not engaged, or your core may not be engaged, which leads to bad posture. Be sure to have good ergonomics when sitting at your desk or in the car as to not worsen your posture or joint pain. Working on moving your joints through their full range of motion is a great way to help prevent arthritis or joint pain in general. Paying attention to how your body moves and the limitations it may have during that movement is crucial to catch early. The earlier the better, because it can save you lots of pain and annoyance down the road. Smoking and arthritis. Studies show that a person's risk of developing rheumatoid arthritis isn't limited to genetic predisposition. Environmental risk factors also play a role in who develops rheumatoid arthritis, and smoking has been shown to be one of the strongest environmental risk factors. The mechanism isn't well understood, but researchers suspect smoking somehow ignites faulty immune functioning in people who are genetically predisposed to rheumatoid arthritis. This risk is thought to be greater in people with certain types of genetic factors that are associated with rheumatoid arthritis. Bottom line, smoking is a major risk factor for developing rheumatoid arthritis that is completely preventable. Smoking also decreases the effectiveness of drugs prescribed to treat rheumatoid arthritis and can be a barrier to engaging in activities that may relieve symptoms of rheumatoid arthritis, such as exercise. Many people with RA aren't aware that smoking makes their condition worse, so they don't recognize this as a reason to quit. Other factors unique to RA present additional challenges to quitting. These include the idea that smoking is a distraction that helps people cope with the pain of rheumatoid arthritis and feelings of isolation and lack of support. If you have rheumatoid arthritis and also smoke, quitting could have numerous benefits. Talk to your doctor about strategies to help you quit and improve your overall health, as well as the progression of your rheumatoid arthritis. Coping and living with arthritis. Resilience. Resilience impacts thoughts and therefore behavior in profound ways, says Chicago-based psychologist and physical therapist Elizabeth Lombardo. A less resilient person experiencing a flare might think, well, I can't exercise, or my doctor isn't helping me enough. A resilient individual thinks, how can I improve my situation? What can I do to get moving again? Focus on the upside. Studies show that optimism is part and parcel of resilience. The more hopeful you feel, the more resilient you'll be. Boosting your optimism requires you to reframe your experience so that you're aware of the negative but focused on the positive, says David Hellerstein, MD, professor of clinical psychiatry at Columbia University's College of Physicians and Surgeons in New York City. Ask yourself 3 questions, he says. Does this provide new opportunities? Can I look at this differently? Is there any good to come out of it? Expand your knowledge. Ask lots of questions when you're at the rheumatologist's office and regularly read up on arthritis and health. Learning boosts resilience, says Dr. Hellerstein. The more you learn about how best to live with your condition, the more control you have. Control, as well as resourcefulness, gives you the confidence to move forward in the face of adversity. Seek support. Support systems are a linchpin of resilience. If you don't feel like you have to go it alone, it's much easier to push forward when the going gets tough, explains Wicks. Not used to asking for assistance? Most people have a hard time with that, points out O'Gorman. Realize that it's not a sign of weakness. Chances are your loved ones want to help and are simply waiting for you to ask.